Hi, this is Dr. Nidhi Patel, and today we will review the case of paraspinal approach for large L4 L5 extraforaminal disc herniation using monoportal system. We dock at L5 transverse process SAP junction, and then we cleared the soft tissue. We identified the transverse process of L5 SAP, and we immediately found that large disc herniation had already breached the intertransverse ligament, and this cord-like structure is nothing but the um, medial branch to the facets, which pain physicians do the lot of rhizotomy. We can just cut it, which help in giving good back pain relief. So then we proceeded with the discectomy. We did the debulking, but then we were not still able to identify the exiting route because we had not removed that intertransverse ligament completely. So this is actually the end picture. So what we did, we moved cranially. We identified that L4 transverse process, which I'll just show you. Yeah, this is the L4 transverse process, and from there tracing that structure medially over the pars, the soft tissue was cleared there, and then there we got that remnant of that intertransverse ligament. As we cut open, we could find that L4 exiting route way back medially from the canal and till lateral end. This is the end picture. So L4 exiting nerve root has been decompressed well. We are doing from the right side, so 3 o'clock is the cranial, that is towards the L4 transverse process. 6 o'clock is lateral outside the foramen. 12 o'clock is the medial towards the canal, that is actually pars, and just beneath that is the SAP from the L5. So L4 root has been decompressed, and here extraforaminal area, usually this herniation can have a lot of cartilaginous tissues, which is very hard. So one has to be careful, and one should not do any blind pulling, because it can just crush the exiting root and damage the dorsal root ganglion in the tight space. So that's why we moved cranially, and we did removal of the intertransverse ligament. So once you have your structures clear, you can just proceed. You can do easily retract that structure if necessary. And yeah, so because a lot of disc material had degenerated, quite some disc also came out. This is the superior articulating process of L5, which is almost abutting the L4 pedicle cranially there, and we can see that exiting nerve root is totally decompressed, though quite congested. The patient had very good symptom relief post-op. So this is the end picture. Thank you.